from getting students back to school to the spread of the variants?
Here to answer some of those questions is Dr. Erica Shenoy. She is the Associate Chief of the Infection Control Unit at Mass General Hospital. Dr. Shenoy, thank you so much for joining us this morning.
Good morning.
Well, the CDC announced 5 key strategies to safely reopen schools, but vaccinating staff is not one of them. That's making a lot of teachers upset. What do we know about the risk to adults in the classroom?
Yeah, so I think one of the big questions we've all had as schools have reopened is it safe? Are we going to see, when schools open, transmission from child to child to teacher, and teacher back to child? And what we've been seeing in many, many studies now coming out is schools are doing very, very well with in-person learning. So study after study, and even some of the most recent studies showing that even in situations where community prevalence is quite high, with the mitigation measures in place, schools have been incredibly successful. I would say from my own perspective, I'm a mom. I've got 4 kids, 3 of whom are in the hybrid school system in our local public schools. They're doing a tremendous amount of work, and it's really paying off.
That's really good to hear that from you. Earlier this week, Health and Human Services Secretary Mary Lou Sutter said she believes it would be several more weeks before the state opened up the vaccine to residents in that 65 and up age group. But there's appointments available. Should the state move to the next age group? How vulnerable are those people 65 to 74 to becoming seriously ill?
Right, so the relationship between age and risk, if infected, of developing severe illness, hospitalization, if hospitalized, needing to go to the ICU, needing ventilator or breathing support, and unfortunately death, is really very tightly linked to age. And you can see from published data that as you go up in decades, the highest risk are obviously the oldest. And so as soon as vaccine supply allows it, we need to make our way through those age groups.
The number of people in the hospital with COVID and the positivity rate are trending down. How do you feel about where we are right now?
So I'm very optimistic. So I check out the Mass DPH dashboard as soon as it comes out every evening, and all the 4 key indicators on that dashboard that are being tracked very closely. The 7-day average of new cases, percent positivity, we're below 3% now. Number of hospitalized patients and deaths are all trending in the right direction. I think that's terrific news.
I think a lot of us are doing that. And we've heard that the UK variant could become the dominant strain of the virus sometime in March, but we're halfway through February. Is it becoming more prevalent in Massachusetts? Are there signs it could take over here?
So when I looked at the numbers last night, to date, there had been 10 of the B117 detected in Massachusetts. There's a lot of work ongoing to try to find more of these, do sequencing, and identify them. I think what I would say is the experience in the UK, their introduction to the B117 variant was in the fall. It quickly took over as the dominant strain, but their curve came down and is continuing to come down. So I think that's reason for optimism that many of the things that we know how to do can be effective against the variant. And then the other big picture item here is that the less virus overall is out there, the less opportunity for variants to get into the mix. And so we just have to keep doing what we're doing and follow those numbers down the curve.
Before you go, we want to ask you a question about the vaccine. We came across people at vaccination sites this week who said they were going to get their second dose at another site, even if that site carried a different vaccine. Can you mix and match these shots? And what about a possible booster down the line? Will that have to be the same brand?
So I think in exceptional circumstances, you could mix a Pfizer and a Moderna. And those are really exceptional circumstances where, for example, it's not known which was the first dose that was administered, or there's an inadvertent administration of one of the 2 vaccines. They're both mRNA vaccines, but really priority should be given to trying to get the same vaccine brand that you got. But again, in exceptional circumstances, it's okay to proceed with that.
Okay, Dr. Erica Shenoy of Mass General Hospital, thank you so much.
Very good information.